Hey, it's your afternoon girlfriend, Yvonne Daniels. Happy Monday. Hope you're having a great day. And as you can see, man, I told you we're going to be going live and we are have a special guest. We're going to be talking about something that's very important that we all need to talk about and just, get it out there so that we can make sure that we are taking the best care of ourselves possible. We're talking with the Michigan Department of Health and Human Services. I have got Mr. Orlando Todd, who is the director, the Bureau of Health and Wellness of the Michigan Department of Health and Human Services, Public Health Administration. That's a mouthful. How you doing, Orlando?
I'm doing really good, Yvonne. I'm just happy to be here. Thanks for inviting me to talk about this important issue here.
It is so important. And of course, we all know what we're going through with the pandemic, COVID-19, the vaccine. But there are some other issues, and especially in our community, the African-American community, that we need to talk about, some things that we just don't talk about. And I'm just so happy that you all have this awareness program, the HIV Awareness Program, that we have probably seen in a lot of the various media outlets across the state. So can you tell us a little bit about this whole HIV awareness program?
Yeah, this campaign, I'm really glad you mentioned that. It's airing right now, and I think you're going to really enjoy our ads that we have out there. And the reason why we're doing this is because there are currently 1.2 million Americans living with HIV. And just in Michigan alone, it's estimated that 1 in 8 people are unaware of their HIV status. So the focus of the media campaign is reducing the spread of HIV through prevention and treatment.
So, we talk about HIV, and I think that a lot of times, especially in the African-American community, of course, we know starting back in the 80s, there was like a laser focus on it. And, a lot of people were talking about it. But through the years, we don't hear as much about it. And so I think that a lot of times people are not, or they think that maybe, it's not that serious of a problem, or, that people don't need to get tested because, we kind of got it because we don't hear it. It's almost kind of like, it's top of mind and it's important to people. So what would you say to that and people that think that, not as bad as it used to be?
No, the issue is still out there because, we want people to get tested. They want people to get into treatment, want people to be aware of their status, to prevent the treatment. So it is still out there. It's a really important concept for people to know that, we still need to get tested. I know you're not hearing much about it. And that's the whole reason why we launched the awareness campaign. Just let people know this is still an issue out there for everyone. And it's still a big issue for our community.
Yeah, for sure. And, it has been so taboo in our community for so long.
Yeah.
And, just thinking about the numbers that you just recited, the 1.2 million Americans that are living with HIV, and in Michigan, 1 in 8 people that are unaware of their HIV status. And it's definitely very important to know your status. We were talking a little bit too about just the vaccine and with COVID-19 and underlying conditions. And with HIV, if you are positive and you don't know, you could have some underlying conditions that could affect COVID-19.
Yes, and that's so true. That's why we're urging everybody when that vaccine becomes available to you. And I know we're moving around with phases, like we're in phase what we call 1B now, and 1A we vaccinated pretty much the healthcare professionals, or what we call first line healthcare professionals. And right now we're on people who are 65 and older. And as we advance into it, we'll probably be getting to people. We'll announce that later about people who have underlying conditions. So it's really important that people get out there and get that vaccine. And then Yvonne and I, we were talking earlier, we do know, like in our community, especially in African-American communities, there's hesitancy. People don't want to get the vaccine because they don't know if it's safe. They don't know if it's reliable, or, you got out there, it was tested really fast. It is a safe vaccine. It's been proven so. Actually, as a matter of fact, African-American woman was on the team to help design the COVID-19 vaccine. So it is important, like Yvonne was saying before, because HIV does cause many people to have underlying medical conditions. So it's really important to get out there and get that vaccine and get vaccinated when it becomes available to you.
And once again, to get tested for, especially if you are in a situation where you know that you have been exposed and that there's a possibility you could have HIV, you definitely need to get tested. And one thing that's really cool, what about early detection? How good is it to have early detection of HIV? How will that help them?
So early detection, we want people to know that there have been great advancement in HIV treatment. They're allowing people to have the virus to live long, full, and happy lives and stuff like that. So, you know, if you do get tested and you do have HIV, people can living with HIV can feel confident that if they are an effective HIV treatment medication and achieve undetectable viral load, they cannot pass on HIV to sexual partners. That's why testing the proper treatment is so important.
And also too, especially in our community, you know, we want to make sure that our information doesn't get out there. You know, we've had some issues with that. So that's why people don't feel as comfortable in our community. But when you get tested, your results are confidential, right?
Yeah, those results are totally confidential, Yvonne.
Yeah.
People don't other people finding out your status is totally confidential when you go get tested.
Right, right. Now, talk a little bit more about just the advancements, because I know that you know, I even think about back in the day, you know, when Magic Johnson, when we all heard, I remember where I was when I heard the news. You know, he's still living a healthy life. People say, well, you know, he was able to have the money to get the cocktails. You think about an Easy E. I remember that too. I remember where I was when I heard that information too, and it was so quick, and you know, it was like, oh my goodness. But once again, and you may have said this earlier, but the advancement in the medicine has come so far. The advancement in the medicine with HIV, as far as the medicine and people being able to, when they are diagnosed, if they are diagnosed, are able to live longer because the treatments, the advancement and the treatments and the medicine has come so far, right?
Yeah, the medicine has come really, really far. Because I know when you were mentioned earlier before, when you were talking about Magic Johnson and Easy E, you know, back then they had different treatments and it was called like a drug cocktail. And then now in some cases, we're down to like one pill a day. So we always tell people that early detection, intervention, and treatment can reduce the risk of HIV transmission by 93%. So we just want people to feel confident. And when you're on the right treatment, and you're taking your medication, you can achieve an undetectable viral load. And as I said before, when you have an undetectable viral load, that means that you cannot pass on HIV to sexual partners. That's why we keep on saying important testing and treatment is really important. And just I want to mention this, Yvonne, just an important concept for those most at risk of contracting HIV to keep in mind is undetectable equals untransmittable. So that's what we were just saying. It's like when you get tested, and if you do test positive, you get into medications and treatments.
For sure. So we've said this, but where can people get more information about what we've been talking about, how to get tested? I see the website here. So can they just go to this website, michigan.gov/HIVSTD?
Yes, they can. For more information, you know, just to find out about it is michigan.gov/HIVSTD.
Okay. And there's also a number, and I may have to put it in the chat, but I think the number is, if I'm not mistaken, 800-872, there we go, 2437. So you can also call that number. And, you know, knowledge is power. So, you know, one thing I would say is, you know, I know that you may be a little frightened, but you can do something if you know the treatment has come a long way. And so we want to make sure that people are getting tested so that they will know their status for themselves, but also for other people, so that you're not spreading it. Okay, there's a responsibility in knowing your status, and so we definitely want to make sure that people definitely understand that.
That's right, and you're right, Yvonne. There is so much power with knowledge, and on that hotline number that you got, you know, can ask questions. We have people that can answer any questions that you may have. Yeah. You know, and just that website that we mentioned before, and that's Michigan.gov/HIVSTD. This website is where you can find information about prevention measures, about testing centers, and can teach you how to live your fullest life possible if you do have the virus.
Yeah. Perfect note to end on. So if you do have any questions, please go to the website. I'll call that number. Orlando Todd, you have been wonderful. We thank you so much. He is once again the director of the Bureau of Health and Wellness with the Michigan Department of Health and Human Services. So we thank you so much, Orlando. We appreciate you and your time and your information. And if you don't know your status, please go to the website, call the number, get the information, know your status, and like Orlando said, live a long, beautiful life. So thank you, Orlando. I appreciate you.
Thank you for the opportunity to talk to you today, Yvonne. And once again, that website is michigan.gov/HIVSTD.
For sure. Thank you. Keep up the great work.
All right. Thank you, Yvonne. Have a
All
great
right.
day.
You too. Bye.